Hi, I'm Cheyenne. I'm Dr. Kamongasolo's medical assistant, and I'm going to explain to you the EMG NCV nerve conduction study. Dr. Kamongasolo will be performing an EMG NCV nerve conduction study. This will be a two-part procedure. The first part uses a handheld device that transmits an electrical current to stimulate the nerves in your arms and legs. This part of the procedure begins with a stronger current in order to test your motor nerves, which are those you use for movement. Next is a less intense current is used to test your sensory nerves, which are nerves you use for feeling. The second part of the procedure is the needle portion. It is a very small needle similar to that used in acupuncture. This needle is then used to probe multiple muscles in your body. With this portion of the test, there is a microphone and a speaker involved so that Dr. Kamongasolo can hear how your nerves and muscles are communicating. She will also be watching a computer graph along with listening for specific sounds your body and nerves are creating. Although some of the testing may seem unrelated to your symptoms, this testing method allows us to do a complete analysis for diagnosing issues with your neck and/or back. All of the human body nerves go down your neck and back and travel out to your arms and legs. By testing the different areas in your arms and legs, we can trace them back to where the source signal is coming out from your neck or back. This testing will indicate which levels of the neck or spine are involved and can signal if you have either nerve damage, muscle damage, pinched ulnar nerve, or carpal tunnel. This test can also indicate the level of severity if a problem is found. Dr. Kamongasolo will start with the hands or lower legs and work her way up. The hands tend to be the most uncomfortable part of the test, so she will do her best to complete this as quickly as possible. Next, she will move up your arms to the bigger muscles. The good news is, the bigger the muscle, the less sensitive it is, and the less you might feel. So during this part, if you don't feel much, don't worry. That is completely normal. In some cases, she might also test the paraspinal muscles in your neck. If your condition calls for the lower extremities to be tested, she will start with your lower legs and work her way up. In some cases, she will need to test your hip muscles and paraspinal muscles in your lower back. For this test, she will ask you to lower your shorts in order to access these muscles. Because during both the electrical and needle portions of the testing, Dr. Kamongasolo will be concentrating and listening to the sound waves from your nerves and muscles. Therefore, she will not be doing a lot of talking. However, please keep in mind at any time during the testing, if you have questions or concerns, please speak up immediately, and she will pause the test to address your concerns or answer any questions. Please keep in mind that you will not be receiving your test results today. However, you will be able to discuss your results with the referring physician at your follow-up appointment. Anytime we use needles, bleeding, bruising, and infection is always a concern. Call our office if you have any issues or questions. There are no restrictions after this procedure. You can do your normal day-to-day things, and tenderness, soreness, bruising is common and will go away in time. If at any time you cannot complete the EMG NCV nerve conduction study, let us know. We do request that you try to complete the study so the requesting provider has all the answers they are looking for. If you cannot complete the test, it is considered an incomplete study and you may be requested to repeat the procedure.